Well, this week on Your Morning, we spoke with two women who experienced health problems after getting an IUD. The Canadian Pediatric Society says doctors should be offering IUDs as the first line of birth control option for women. Dr. Titilayo Olupona, a family doctor, is joining us this morning to talk about some of the pros and the cons of the IUD. Welcome to Your Morning.
Thanks so much for having me.
First of all, back to basics. There are two forms of IUD available for women in Canada.
Yes, they are. So we have the copper IUD, which has no hormones. Then we have the hormonal IUD, which is either the Kalina or the Mirena IUD.
All right. The Canadian Pediatric Society says the IUD is the most effective method of birth control. What are some of the pros?
Some of the pros, number one, it's so cost effective. It's actually very convenient. You don't have to worry about taking a pill every single day. Patients get lighter periods, and it's actually one of my favorite things I recommend to my patients.
What about some of the cons? You know, the women that we spoke to, one of them suffered from numerous urinary tract infections, so she finally had hers removed. The second woman we spoke to, she got pregnant while using the IUD, and then they couldn't find it in her body for almost a year. She also experienced some health concerns related to that. What are some of the other cons of having an IUD?
So some of the cons of having an IUD, number one, you can get irregular periods from this. And also, two, some patients who are concerned about perforation. And also, two, some patients are also concerned about mood changes as well. But overall, I think it's, I think that the most difficult cons would be perforation and just mood changes. That's the most important thing.
All right, the big concern for the two women that we spoke with in our stories, and if our viewers haven't had a chance to see it, you can go online or check out our YouTube page. You'll find those stories there. They were told having their IUD was not the cause of some of the health-related issues that they were having. If women are having health concerns, they are having, urinary tract infections, if they are feeling something is off with their hormones, aches, pains, fevers, what steps should they take in order to have their IUD removed?
So number one is each patient is going to be different. You see your physician. We sort of take a thorough history, and also too, we do an ultrasound to make sure it's in the right position. We want to make sure that no other reasons are causing these issues. And then normally I tell my patients, if you're not tolerating it well, just come in and whether you have a family doctor or a gynecologist, to remove it as soon as possible.
All right, doctor, I want to thank you for coming in today.
Thank you so much.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.